So today is January 16th, and I'm gonna be teaching Sandra here about sudden infant death syndrome. My name is Emma Hayford. So Sandra, what do you know about sudden infant death syndrome?
Not much, but it sounds like the baby suffers a death suddenly, maybe in their sleep.
Mm-hmm. Mm-hmm. Right. So it's when an unexpected death usually happens to a healthy baby in a sleep. Okay, less than 1 year old.
Um,
Okay, and we have causes could be like physical factors and sleep environmental factors. Okay, and I would like to ask you, how does your baby sleep?
my baby usually sleeps by me at night.
Okay, so the baby sleep with you on the same bed?
Yes.
All right, so could you think about any danger?
Well, I suppose that I might move wrong and hurt him, but
Mm-hmm.
I just like to form that bond with him, especially now.
Right, I understand. Most mothers want their babies by them, but at the same time, we have to think about the safety of the baby. So it is advisable that the baby sleep in his or her own crib. Do you have a crib for the baby?
Yes.
All right. Yeah, I can see you have a crib here. Sandra has a crib for the baby here. All right. So, how your crib? So Sandra has a crib here, and she has something in her crib. We don't want to have anything in our crib. Okay, you don't have to have nothing in the crib. Like, this is not safe for the baby, so we take that off. And no blanket. Okay, so no blanket in the crib. Okay, and the mattress has to be firm. So
Can I
remember,
have a blanket laying on the baby?
no, we don't want nothing on the baby. Okay, just make sure the mattress is firm, nothing in the crib, no toy, nothing. Okay.
So, what kind of pajamas are safe for him to wear to
We know
bed?
we have. Do you know we have a square the pajamas that they could like the sleepwear. They have those sleepwear that cover them from top to down.
Okay.
You could just
Yeah, I
put that
just
one
don't
on
want
there.
him to get cold, especially since it's winter.
It is winter, and also we'll be talking about that. We need to have like the right environment, the right temperature for them as well. So we have physical factors such as brain defects. So some babies are born with brain defect that put them at risk for sudden death, sudden infant death syndrome. Okay, and another physical factor will be low birth rates, low birth weight. Sorry. So how what was your baby's weight?
He was 6.5 pounds.
All right, that's a healthy baby.
Okay.
That's a healthy weight. I mean, and respiration infection as well. Some babies are born with respiration infection. You can just imagine if they have stuffed nose and all that. And we talked about the environmental factors, and you told me that your baby sleep with you, and we said it was not right, so it was advisable for the baby to sleep in his crib. However, you can bring the baby's crib to your bedroom.
Okay.
Okay, so you can be seeing the baby in the crib. Okay, so we want to have the baby in the crib in our room, not sleep on by you.
Can
Baby
I
should
have a baby monitor inside the crib?
We'll be talking about that.
Oh.
We don't want anything in the crib. Remember that. No baby
Okay.
monitor, no baby toys. Okay? Yes, we don't. That's a good question. Sleeping on a soft surface is not advisable. So no baby monitor, no baby crib, nothing. So, and another overheating, like the room should not be too much, like shouldn't be too, not too heated. I know it's very cold. We think we need the room to be very like boiling up, just reasonable temperature. Okay, I would think like right. Normally, I set my thermostat to like 73, 74.
Okay, that's about where I keep it.
All right, so I think that would be a reasonable one for the baby too. So there are some risk factors that put babies at risk, like for instance, sex of the baby. Can you think about any sex that will put the baby at risk?
Maybe girls.
To be honest, I rather have boys.
Oh.
Boys are prone to
Is
sudden
that
infant.
because they may move more in their sleep?
To be honest, I don't know. They just feel like boys are prone to that. And the age, infants are most vulnerable between the second and fourth month of life. They said infants are more vulnerable when they are around the second, the fourth, and the race of the baby. What do you think? What race do you think?
I would think maybe ethnic groups like African Americans,
Yes,
Hispanics.
yes, for reasons that aren't well understood, non-white infants are more likely to develop sudden infanticide. I will just think about like the socioeconomic factors, like
Maybe we can't afford a
we
crib.
cannot afford a crib, so most babies sleep in their my parents' bed.
Okay.
All right, and family history of people who has ever experienced sudden infant death syndrome as
Mm-hmm.
well, and secondhand smokers, people who smoke, babies who live in smoke with people who smoke, put them at risk as well. Okay, so both being, and also we're gonna be talking about like the maternal risk factors. Can you think about any risk factors like regarding a mother that will put the baby at risk?
Maybe. I can't think of any to
Okay,
be honest.
like young mothers
Okay.
less than 20. Like how old are you?
I'm 35.
Okay, that's good. You look young.
Oh, thank you.
So mothers who are less than 20, mothers that use drugs, alcohol,
Okay.
smokers.
Well, during my pregnancy, I did smoke, but I quit afterwards.
Oh,
Is that okay?
you did smoke?
Mm-hmm.
Okay,
Just like one or two a
okay,
day.
okay. Oh, normally, people who smoke affect low birth rates. The reason why we don't want mothers to smoke because it affects the baby. The babies are born with low birth weight. Okay, but it looks like your baby is healthy baby. And mothers who do not have inadequate prenatal care. Okay, prenatal care. And now, saying this, what do you think we can do? What do you think you can do as a mother to prevent sudden infant death syndrome?
Well, I'll start letting my baby sleep in his crib. I'll move the crib to our room, and as I said, I don't smoke any longer, so that's something I'm trying to do.
Okay,
And of course, no baby monitor in the crib.
all right, awesome. And I forgot to ask you, how do you put your baby to sleep?
Usually I let him sleep on his back,
On his back.
and
Good,
I rub him to sleep.
good. That is the right position. Babies are supposed to sleep on their back.
Okay.
Some people put their babies on, not on the side, not the belly, on the back. Okay, so there are no guaranteed ways to prevent it, but however, back to sleep, we have to put them on the back, just as we said. Okay,
And what's the purpose of that?
I guess when you put the baby on the belly, the baby's nose is right on the mattress and you cannot move the baby, so it put the baby at risk of suffocation. You know what I mean?
Right.
Yes, so I guess if the baby is lying on the back, it's less risk for the baby to be suffocated.
Could it also have something to do with them vomiting? Maybe in their sleep?
Aspiration, probably too.
Oh, okay.
Probably too, yeah. So don't assume that others will place your baby to sleep in a correct position. It's your responsibility to put the baby in the right position, okay?
Okay.
Keep the crib as bare as possible. Use a firm mattress and avoid placing your baby on a thick, fluffy paddle, such as lambskin or thick quilts.
Okay.
Don't leave pillows, fluffy toys, stuffed animals in the crib. This can interfere with breathing if your baby's face presses against them. You know why we don't keep all those things in the crib, right?
Yeah.
Now, another reason, don't overheat your baby. To keep your baby warm, try a sleep sack or other sleep clothing that doesn't require additional covers. Don't cover your baby's head, okay? Have your baby sleep in your room. Ideally, your baby should keep in your baby sleep in your room if you but alone in the crib. So your baby should sleep in your room, but it's in the crib. Okay? And adult bed aren't safe for infants. We already talked about that. Because our beds are not firm, baby need to sleep on a firm mattress. A baby can become trapped and suffocate between the headboard slats. So the baby has to be in a crib, and the space between the bed frame or the space between the mattress and the wall. So that's why the baby has to sleep in the crib. A baby can also suffocate if a sleeping parent accidentally roll over and cover the baby nose and mouth. And also breastfeeding. How do you breastfeed?
Yes, I do.
Good. So we encourage mothers to breastfeed their babies at least for 6 months.
Sometimes I do have trouble with producing milk though.
All right. So yeah, are you mixing or you are going exclusive breast milk?
And I mix them with formula.
All right, that's fine. I think baby is getting breast milk. So don't use monitors other than commercial devices that claim to reduce risk of SIDS. So no monitor in the baby crib, okay?
Okay.
All right, and offer pacifier. Does your baby use pacifiers? What kind? Does he have a string attached to it or just a normal one?
It honestly depends. We have both.
All right, so when we're gonna put baby in bed, just make sure the baby has the pacifier without the string attached to it. Okay, just the bare one. Okay. And immunize your baby. Okay, make sure your baby is up to date with his vaccine. Okay, there's no evidence that routine immunization increases SIDS. Some evidence indicate that it is actually prevented. Okay, so now I need you to, I'm gonna be demonstrating to you how you're gonna be putting baby to sleep. All right, so baby, go to sleep like that. Baby, go to sleep like that. Oh, it's a baby, healthy baby, smiling. Smiley, cheeky. So make sure always your baby is like this, okay?
And is it safe for him to have that bib on while he sleeps?
I'm sorry?
Is it safe for him to have his bib while he sleeps?
No, you take the bib off.
Okay.
Remember, no hat, no bib, okay? So no hat, no bib. Otherwise you will hit the baby. Okay? Oh, so cutie. All right, so Sandra, do you have a question? Any question for me today?
I don't.
All right, thank you so much for your time, and I wish you all the best with you and your baby. All right, thank you. Bye-bye. All right, so I forgot to give Sandra this when I was doing the teaching, so I do have some information for you here. Okay, Sandra? This is from MCH Library. For additional resources, you can access all these resources by following the direction, okay? And I have another resource here for you, ACH, and follow all these directions, okay? If you have any more questions, okay? All right, and thank you so much for your time. Thank you. Bye-bye.